symptoms affect everyone differently. No two people with the disease are alike. This is because the signs and symptoms vary from one person to another and affect different regions of the body. One person might have leg weakness and the other one might have difficulty holding utensils. The number and degree of symptoms typically increase as the illness progresses. Depending on where you live within the province, there may be a number of service providers and subsidies to assist you manage your journey with ALS. Some communities have interdisciplinary ALS clinics to help with mobility, speech, nutrition, and breathing challenges that may arise. You might also be followed by just a neurologist, a family doctor, and the CLSC healthcare team. See if they can refer you to one of these interdisciplinary clinics. The healthcare team at your CLSC will also work with you to obtain assistive devices, mobility and communication aids, as well as varied subsidies according to your needs and their availability in your area. Here's an example of some teaching I did at home with the family. Hi, Mrs. Smith. I'm Ann-Marie from the CLSC.
Oh, hello.
Nice
Welcome.
to meet you. Thank you. Thank you.
Come in, please.
Oh, you have a beautiful home.
Thank you. I'm glad you're here.
Thank you. That's your husband?
Yes.
Hi, Mr. Smith.
Hello.
Nice to meet you, sir.
Please have a seat.
Thank you very much. So, how are we doing? How are things?
Well, it's a lot. There's so much information. I just don't know what to do and could certainly use some help.
I'm sure. Well, that's why I'm here, to try and guide you through things, make life easier for you and your husband. So we'll take it one step at a time, okay?
Yes, thank you.
Please note that considering and learning about home adaptations is not a question of accepting the disease or your ALS diagnosis. The main objective is to assist you to maintain your autonomy for as long as possible and help guide you and your caregiver develop ways to compensate for the difficulties that arise over time. Although both the person who has ALS and their family members are part of the same team, it is very common and normal to see that each person is on a different wavelength than the other in terms of accepting and adapting the daily realities and the progression of the illness. This can be a source of great frustration and conflict with families and can come in the way of optimizing the safety of the home environment. One of the most difficult things to do is to anticipate and prepare for things before you need them, especially when fatigue and weakness are just beginning. It can be extremely difficult to look ahead. However, keeping a close eye on any changes in your ability will help you prepare for your future needs. Being proactive will not only save you and your caregiver a lot of additional stress later on, it will also lower everyone's risk of injury by making daily tasks such as transferring and repositioning less taxing and more safe for everyone at home. It is completely understandable if you feel overwhelmed by the information you are receiving. ALS is a complex illness. The point of this Taking Care series is to provide information in bite-sized segments, help plant some seeds of practical advice by experts so you'll be equipped and aware of what could be available if and when you are ready for it and when the situation warrants it. It is like bringing the information of experts into your home when the timing is right for you. Most people living with ALS want to remain at home for as long as possible. So in this first segment, we will be highlighting specific strategies to help you and your family remain as safe as possible in your home environment throughout the disease progression by introducing a variety of potential home accessibility adaptations. As previously mentioned, there is no easy way to know how quickly your body and ability will change, and waiting until you lose your autonomy and function and not having the equipment or aids available when you need them will be frustrating and will increase the overall stress level for everyone. There is no point in forcing anyone to accept something when they are not ready, but remember, delays in getting equipment and adaptations are unfortunately very common. Keep that in mind and think of your future needs and those of your family members and discuss these openly with your healthcare team. Home safety evaluations are carried out by OTs throughout the different stages of your ALS journey. It is of paramount importance to be honest about any difficulties or struggles you experience in getting through your daily activities. This will allow the OT to tailor the recommendation to your unique circumstances and optimize your safety as well as that of your caregiver family. Here's an example of some teaching I did at home with the family. So the first thing I noticed coming here to see you were the 7 steps, okay? They might be okay right now to be done, but as the disease will progress, it'll be harder and harder to do, okay? So I'm gonna be giving you, there is such a program called a PAD that can assist you in adapting, modifying the steps, okay? This is the form. The reason why I'm saying it now is because it's a quite lengthy process. It's time consuming and there are delays. So take a look at the form. Obviously, if you have any questions, I'm here to help. There is a wide range of possible home modifications out there, from temporary to permanent, low-tech to highly sophisticated, and from inexpensive to costly. Keep in mind that before you start any kind of modifications, you need to have as much information as possible in order to make an informed decision. The decision may come to having to move. The modification options vary depending on where you live, region to actual dwelling, owner or tenant, the financial resources available to you within the healthcare system or personally, and the family caregiver involvement. It is highly recommended that you talk with the healthcare team involved with you prior to buying anything. This is because they are knowledgeable about the best equipment options available for you as well. Many items are covered or provided by the CLSC, rehabilitation centers, or community programs, such as the ALS Society of Quebec one-time $1,500 residential adaptation financial program. Some items, if prescribed, may allow you to benefit from tax exemptions or deductions, and private insurance can help to defray costs in many cases. Please find some helpful web resources that highlight various aspects of home modifications. Please take note that some of these are uniquely available in the original language of production. Here are some examples of accessibility modifications of the home. Handrails, grab bars, doorway sill ramps, ramps, portable or fixed, elevated platforms, elevators, access to the garage reaching many floors, automatic door opener. Here are some examples of accessibility modifications within the home. Removing carpets, area rugs, clutter, removing doors, installing offset hinges, changing door handles to lever-style ones, relocation of bedroom to main floor. Thank you very much for joining me in this Taking Care segment.